Obesity is not a disease. It's a symptom. It's a symptom of many different disorders in mechanisms that usually are critical, like your metabolism. If you try to treat the obesity by changing the metabolism or any of these other systems, you're probably going to have side effects and severe problems. There is one exception to this. Some foods, when you bite into them, release endorphins in the brain. And some people become addicted to these foods. When you bite into a chocolate bar, and then there's going to be this flow of endorphins throughout your brain. And this endorphins are like opiates, and people become addicted to these foods. Now, this is an area that we know quite well because we had developed a treatment for alcoholism based upon the fact that alcohol releases endorphins. And so we developed this many years ago. It's been tested in over 80 clinical trials. It works for about 78% of the alcoholics. It's also been shown to work for amphetamine or pathological gambling, which releases endorphins. We expected that it should work also for these addiction to special foods. Now, the addiction to these foods shows up usually as binge eating, just as alcoholism shows up as binge drinking. So we then got started to do a clinical trial using a method very similar to what we had for alcohol for the treating of binge eating.